How do wildlife rehabilitators cope with euthanasia decisions? Imagine caring for an injured animal, knowing that sometimes the kindest choice is to say goodbye. Making euthanasia decisions can be one of the toughest parts of wildlife rehabilitation. When animals come into care, their injuries or illnesses are often severe. Rehabilitators must decide if treatment will help or if euthanasia is the most humane option. These choices are based on clear guidelines that prioritize the animal's welfare. If an animal's injuries are unlikely to heal, or if they are in constant pain, euthanasia may be the kindest option. Rehabilitators consider whether the animal can recover enough to be released back into the wild. They also evaluate if they have the resources to provide proper care, which can be costly and time-consuming. Safety is another factor. If an animal poses a danger to staff or other animals, euthanasia might be necessary. To ensure humane treatment, rehabilitators use specific criteria, like rapid, painless methods that cause the animal to lose consciousness quickly. Proper training is essential so that euthanasia is performed ethically and safely. When veterinarians are available, they usually perform the procedure. If not, trained rehabilitators follow approved methods to carry out euthanasia. Making these decisions can be emotionally draining, so many rehabilitators involve others in the process. Working as a team helps share the responsibility and provides emotional support. Many organizations have policies in place to guide these tough choices, helping staff stay consistent and compassionate. Sometimes, animals that cannot be released but are not euthanized are used for educational purposes. These animals help teach the public about wildlife and conservation. This requires special permits and proper care to ensure they live comfortably. Ethical considerations are at the heart of every decision. Rehabilitators aim to reduce suffering and treat animals with compassion. They balance the needs of the animal, practical limits, and their own feelings. Euthanasia is always a last resort, used only when it's the kindest choice for the animal's well-being. Overall, wildlife rehabilitators handle euthanasia decisions by following humane guidelines, working with others, and focusing on minimizing suffering. They recognize the importance of these choices in their role and approach them with care and respect.